Hey listeners,
I'm Marty.
I'm Melvin.
And I'm Marcy. Today in Altered State of Mind, we'll be talking about marijuana, also known as cannabis, also known as weed, pot, skunk, reefer, devil's lettuce. There are a million names for marijuana.
We'll be also answering lots of common questions about marijuana. There are a million names for the drug.
But why are there so many names?
There's a lot of factors because smoking marijuana has been around for so many years in so many different cultures. Names also come from different ages, countries, and communities.
Wow, so it sounds like marijuana's been quite a thing for a while then, yeah?
Yeah, it's been pretty big,
It's-
well known.
What was the first name for it, and where did it come from?
I've actually done some research on this, and due to stigma on marijuana in like the early 1900s they would call it marijuana to make it sound more Mexican, as there are more immigrants moving into America, and they wanted to put stigma against it. Weed's oldest name is ganja, and it originates in Jamaica, as far as we know.
Oh, so it's been around for a long time then.
Yeah, it has. It was first criminalized in 1923.
How come?
We're unsure why, but it became illegal in the first place. But some would argue that it was criminalized for racial reasons.
Yeah, like in the 1930s, people said it would make people of color act violently.
Really? That's terrible. And this meant weed would be underground for years, mainly for racist reasons, seen as a dangerous substance.
Yeah, they didn't want people using it, so...
Oh, really?
So it's impossible to OD on it, right? So obviously there's people that take it not for fun, right? For medical reasons.
Medical marijuana is also used for Alzheimer's disease, appetite loss, cancer, Crohn's disease, and many other diseases. Diseases affecting the immune system like HIV or AIDS is also used. Disorders such as anorexia, epilepsy, glaucoma, and some mental health conditions like schizophrenia, PTSD. People also use marijuana to help with their nausea, pain, seizures, and wasting syndrome. People also use them for recreational uses, and they love the way it makes them feel high. It can leave people calm and relieve them from stress, or even just relax with friends.
Alright, so after hearing this, I think we should make the effects more clear. So I think we should talk about the positive effects first.
Yeah, there's stuff like cannabis has a compound called CBD, which has a tremendous amount of benefits. CBD doesn't make you high. CBD also treats and prevents irritable bowel syndrome, inflammatory bowel disease. I also know some older people that have used it to help back pain, joint pain, and helping blood flow. CBD is still being heavily researched, and there's currently a study figuring out how it can be used to treat nerve damage.
How about the negatives?
Okay, so according to current research, as of right now, there aren't that many serious negative effects that have been found. It can cause confusion, fatigue, and impaired ability to remember, concentrate, pay attention, and the ability to react quickly. It can also cause anxiety, fear, or panic. Non-severe effects are damaging blood vessels, decreased blood pressure, and increased heart rate. There have been cases that it caused hallucinations, delusions, and schizophrenia. However, these are very rare cases and only happen if you're prone to it in the future. Long-term effects can have a toll on your intelligence, memory, and the ability to make your own decisions.
Wow, what are the long-term effects on marijuana?
Prolonged use can affect some people negatively. It can also be quite addictive for some. They can have memory issues, anxiety, depression, lower dopamine production, lung damage, persistent cough, and could be at a greater risk for heart attacks, diseases, and strokes.
Wow, have you seen any of these effects in people you know?
And currently, no, I don't know many people that use it.
No, I haven't seen too many.
So, how has marijuana been doing in Vancouver then?
Well, it was first legalized in 2018, and many shops and dispensaries have been opening up selling edibles, joints, and nugs of weed. Marijuana also has a higher usage in Vancouver, so you'll see dispensaries everywhere now.
It is common to see and smell weed being smoked in public now too.
That's true. The other day I was walking down the street and there's just like 5 people on the street smoking joints and just smells like weed.
Yeah, I was in downtown the other day, just walking, and then people just smoke their joints as if it's like a cigarette.
Yeah, people love the feeling.
It's been normalized now.
Yeah, it's all over the place.
So what about schools then? I've seen people my age and even younger using it during or after school. And what happens when kids or teens with underdeveloped brains are using it?
It's not great for kids because it'll affect their mental health. They might become heavy users. They're more likely to experience anxiety, psychosis, schizophrenia, and depression. Teens are more likely to become addicted or believe they're dependent on it and can even affect their learning and memory. And these effects can never go away.
If kids are consuming marijuana, would it lead them to use other substances?
Weed is not a gateway drug, but what may lead to substance use disorder are family history, having another mental illness such as anxiety or depression, peer pressure, loneliness, or social isolation, lack of family involvement, the drug availability, socioeconomic status.
I think research will continue to expand and we'll know more about marijuana in the coming few years.
Yeah, for sure, especially because all of the discoveries we've seen recently in the legalization in the US, research and our knowledge on it will only grow.
What do you see for weed in the future?
I think it'll be viewed just like another substance, just like alcohol and like the other stuff, you know?
Yeah, it'll just be like a regular thing that everybody does.
I mean, I think it's almost already that, isn't it?
Yeah, I mean,
But there are some still people that think
I wouldn't
it's-
say it's just as common as alcohol just yet, but it's getting there.
Yeah, some people like still have a bad view on it, but that's like that with every substance, right? And people will still compare marijuana to like harder drugs like heroin and stuff, right? Because they see it as the
a
same
drug.
class.
Yeah,
As long as there's someone thinking that
it's
a
harmful.
substance is bad, other people may follow that trend and think the same.
Yeah,
It just takes time. Just look at alcohol, how it used to be illegal and now it's super common for people to just get drunk on a weekend. That's it for episode 1 on marijuana. Contact us on our Instagram at Altered State of Mind 2022. Link in bio for all other socials. Thanks for listening and check out our next episode coming soon. I'm Marty.
I'm Melvin.
And I'm RC, and this is the Altered State of Mind.